International health officials say the number of confirmed or suspected hantavirus cases stemming from that outbreak on a Dutch cruise ship has climbed to 11. 3 people have died as a result of the outbreak. 18 Americans who may have been exposed to the virus on board the vessel are now being monitored at medical facilities in Nebraska and Georgia. CBS News correspondent Ian Lee has the latest.
Dramatic footage shows British Army medics parachuting onto a remote island in the Atlantic to treat a man who possibly contracted hantavirus from the MV Hondius.
At the moment, there is no sign that we are seeing the start of a larger outbreak.
The World Health Organization has tied a total of 11 reported cases of the virus to the ship, the latest discovered in a passenger quarantined at a hospital in Spain.
Given the long incubation period of the virus, it's possible we might see more cases in the coming weeks.
One American who tested positive but is not experiencing symptoms is currently being held in a biocontainment unit at the University of Nebraska Medical Center.
Once we have a clear results with some of the testing, we'll be able to decide whether they need to stay in biocontainment.
Health officials here in Omaha are evaluating 15 other American passengers from the ship in a separate quarantine unit similar to a hotel.
Every day we do twice a day symptom check and temperature check. Everyone has remained fever-free and asymptomatic.
2 other cruise ship passengers, a couple, were brought to the Emory University Hospital in Atlanta for care. One of them is symptomatic, but Monday night tested negative.
Hantavirus is not going to be COVID.
While the Andes strain responsible for the deadly outbreak can spread from person to person, experts stress this is not the start of another pandemic.
It is less infectious. COVID was airborne. Most of the transmissions with hantavirus are direct, intimate contact.
Health officials say symptoms of the virus can appear up to 42 days after exposure, but they insist the risk to the public remains low. Ian Lee, CBS News, Omaha, Nebraska.
For more CBS News medical correspondent Dr. Céline Gounder joins us now. She's also editor-at-large for public health at KFF Health News. You were there in Ian's package. You're here, you're there, you're everywhere. We are seeing a slew of misinformation online. People are fearing another global pandemic. How dangerous is this messaging?
So today, Lindsay, I actually used some social listening tools to analyze a sample of over 1,500 hantavirus videos that were together watched more than 1 billion times across TikTok, Instagram, and YouTube. Doctors accounted for 2% of those views. Within days of the hantavirus outbreak being announced, a Houston doctor posted that ivermectin should work against hantavirus. That post got 3.5 million views, and the next day was selling ivermectin for up to $110 with no prescription. And there's zero evidence that ivermectin does anything for hantavirus. But she didn't need to be right. She just needed to be first. And now she's making bank.
Remind people what ivermectin is.
Ivermectin is used for different parasitic infections. Parasitic infections are completely different from virus infections. But hey, if you want to get rid of a lot of scabies in your community, go for it.
Great. All right. Why does it seem like we're seeing so much of this right now?
Well, I think a few things changed after COVID. First, the misinformation accounts became businesses. About 150 key anti-vaccine accounts grew their followings during COVID and built subscription services, supplement lines, garnered speaking fees. Every new health scare is basically a product launch. And that Houston doctor was reprimanded by the Texas Medical Board in 2025. She built her audience during COVID. Hantavirus was just the next sales opportunity. Second, the platforms have stopped policing. So between 2022 and 2024, the major companies dismantled their health misinformation teams. TikTok distributes based on what keeps you watching, not whether it is accurate. And then third, the public health agencies that should fill the gap are weaker than ever. The CDC has not had a permanent director for 8 months and was slow to issue even the most basic health alert to clinicians. That didn't come out until Friday afternoon, which was just 4 days ago.
Doctor, I have less than 30 seconds. What should people do to separate fact from fiction?
Well, first of all, ask yourself, why is somebody posting? Are they selling you something? Are they trying to build a following that they can then leverage to get advertising? That is the influencer business model. So anybody who looks like they're trying to make money, trying to get followers, that is a big red flag.
Dr. Céline Gounder, thank you.